Hi, well done and thank you for caring about your health. Your reward is a consultation with me at no charge, so that you don't have to worry about paying for yet another consultation that may or may not meet your expectations. My track record, however, gives me full confidence that this consultation will not only meet but will exceed your expectations. So, check out the video and see how we can help you. I am Dr. Doug Hawley, the founder of the Allina Spine Chiropractic Centre for Health and Wellness, based in Beacon Bay, East London, South Africa, where we are passionate about helping people with pain to live pain-free lives without the need for drugs or other invasive treatments such as surgery. Just so that you know you're in the right place, I want you to understand that there are many causes of back pain, each responding differently to treatment. A single, one technique suits all approach is therefore simply not credible. We therefore use a range of well-proven, tried and tested chiropractic techniques, allied with highly successful technology, to provide you with a solution that will be best suited to you and your spinal conditions. At least 85% of my back pain, neck pain and headache patients respond positively within 3 to 4 treatments over a 10 to 14 day period. I have had many successes over the years with very few failures. Failures usually are the result of people trying everything else before resorting to chiropractic, by which time they are often too far gone. However, even some of the extreme cases succeed, such as Mrs. Boshoff, who was a week away from undergoing spinal surgery when a friend referred her to me. She cancelled her surgery and recovered fully without it. More recently, Mr. Zulu, a farm foreman who is a vital asset of the farming operation, was brought to me, doubled over with pain and walking with great difficulty, leaning heavily on a walking stick. He no longer carries the stick, and for a laugh he jogs up the pathway to my rooms. And then there is Dr. H, who suffered for years with low back pain, and being a doctor, he knew that he was probably heading for surgery. Although skeptical, he consulted me and is now enjoying life again and referring many patients into my care. Let's take a look at some of your problems. Your first and immediate problem is back pain, discomfort and disability. This always has a depressive effect that results in the liberation of chemicals in your body that have the effect of intensifying the pain. This leads to a pain-depression vicious circle, reducing or in extreme cases, destroying your quality of life and your overall mental, physical and emotional performance. Performing basic daily tasks such as bending over a basin is excruciating and limiting, and just getting through the day becomes an effort. Your next problem is finding a rapid, lasting resolution to your problem. You have probably already tried various solutions and are not entirely satisfied. The practitioners that you have consulted may have confused you about what is actually the problem. You may be wondering why treatment is not working. Why does this problem keep recurring? Is nobody giving you the information and answers you need? Is lack of resolution driving you crazy? Getting really worried that you may end up disabled? Then stop. Let's think about this. Is your current treatment based on an accurate diagnosis? Is your practitioner taking account of your unique set of conditions? Or is he/she applying a single technique approach? Does he/she have a comprehensive treatment plan for you with a range of treatment modalities that can address all of your concerns? Is your practitioner genuinely committed to your full recovery and long-term maintenance? Does he or she obtain your commitment? Are you settling for one-off treatments? Is your treatment unaffordable? These could be reasons why previous treatments may have failed. These obstacles can be overcome. Your next problem may be affordability. Many people settle for one-off treatments and forego their ongoing maintenance because of the high costs. I believe so strongly in the benefits of chiropractic spinal maintenance that, in the interests of patient wellness, I have devised very affordable plans that may well suit your pocket when viewed against other costs such as drug therapy and surgery. Research has shown that patients under chiropractic care take fewer days sick leave, spend less time incapacitated, use less medication, have less chance of needing spinal surgery, and less chance of their spinal problems becoming chronic. My plan is to make these and other benefits of chiropractic available and affordable to people who are committed to their health and well-being. Pain is your body's call to action. To ignore this call carries the risk of escalating pain, disability, high-risk, low-success invasive treatment options, rapidly declining quality of life, and even death by drug overload, suicide, or the body simply shutting down. It is vitally important, therefore, to find the best conservative treatment options for your conditions as early as possible. So, what to do? Check out our roadmap to pain-free living. This is the pinnacle of our pain pyramid, where you are enjoying thriving wellness. If this is where you are, then you are in a good place and are probably already on a wellness plan. This next level of our pain pyramid represents someone who is pain-free and functional and thinks that they are therefore well. But remember, an absence of symptoms does not equal health, and being not sick does not equal wellness. There may be underlying latent lesions that are undermining your true wellness and causing gradual spinal degeneration that will result in a regression to the next level. The third level of our pain pyramid is where you are suffering moderate pain with some reduced functionality. You may by now be so accustomed to it that you think of it as normal. But beware, this is your body's signal that your spine is degenerating and needs urgent attention if you are to avoid serious pain and a very uncomfortable old age. If you are at the fourth level of our pyramid, you are already suffering excruciating pain and disability, and your future health and happiness is under serious threat. You may be heading for major surgery or worse. Your body is telling you to take action immediately to recover your spinal health and move back up the pyramid towards thriving wellness. You deserve it. We all deserve it. If you are serious about achieving a pain-free life and enjoying health and vitality, then there are 3 things you need to do. 1. Use your voucher and turn up for your consultation, where a comprehensive, appropriate treatment plan will be formulated for you. 2. Embark on the recommended treatment program for rapid relief from your back pain. And 3. Choose lasting pain relief as part of our Wellness Accelerator option. Let this process move you from point A, pain, to point B, thriving wellness. Let's take a closer look at the plan phase. During the first phase, you and I will get to know each other. This will enable us to examine all aspects of your problem in arriving at an appropriate diagnosis and treatment plan for you, in attaining your primary goal of pain relief within 10 to 14 days. The voucher that I have given you for a free consultation is a demonstration of my commitment towards your recovery and my confidence in this plan. Let's take a look at each step of this phase. Step 1 is the examination. Together we will obtain a thorough history of your problems and conduct examinations and tests and a postural assessment so that we have a full picture of your state of spinal health in arriving at an accurate diagnosis. During this process, you will gain an understanding of your conditions and your role in the recovery process. The next step is the diagnosis. The information gained in the first step is vitally important in formulating an accurate diagnosis for your conditions. The third step is the formulation of the treatment plan. With an accurate diagnosis and a full understanding of your conditions, we will develop a treatment plan that will achieve your short-term goal of being pain-free within 10 to 14 days. We will also discuss a plan for maintaining your pain-free status. The next phase of our pain-free plan is the treatment phase. In this treatment phase, you will progress from a high pain state through to a pain-free state in 3 steps using appropriate techniques and technology for your specific spinal conditions. Let's take a closer look at the 3 steps of this phase. The first step of this phase is the primary treatment. Your first treatment is aimed at reducing your pain level to a point where you are able to function reasonably well. I will have an opportunity to assess your response and modify subsequent treatments accordingly. The next step is the secondary treatment. Your second treatment is aimed at reducing pain levels to 0 or close to 0 and restoring functionality. Sleeping patterns will improve and daily tasks will become easier to perform. Again, I will assess your response and make any necessary modifications. At this point, we introduce some basic exercises to enhance your recovery and maintenance. The last step of this phase is your tertiary treatment. Your third treatment should have you pain-free and fully functional. It is important to note at this stage that the lifestyle factors that caused your pain episode are still present and will lead to future episodes. Prevention and maintenance treatment is therefore the next step to consider to avoid future pain episodes and accelerated degeneration. Phase 3 of our pain-free plan is the Wellness Accelerator. This to me is the really exciting part. I love freeing people of pain, but I love even more taking them a step further to a place of real wellness where they can thrive and enjoy quality of life and renewed vitality well into old age. From this point on, you can choose to continue with periodic treatments as and when pain strikes, or take the next step into real wellness and prevention. Remember, an absence of symptoms does not equal health, and not sick does not equal wellness. Let's take a closer look at what you can get from the Wellness Accelerator phase. The first step in our Wellness Accelerator is the maintenance plan, and is aimed at maintaining the pain relief that we have achieved and preventing future episodes. It includes a postural education and correction program that will help you to avoid spinal deviations that are the cause of many of our neuromusculoskeletal problems. Disc pathology, such as slip discs or degenerated discs that require more extensive treatment, are also addressed during this phase with some truly awesome non-invasive technology. The first step in our Wellness Accelerator is the Wellness Plan. True wellness stems from healthy communication between your central nervous system, your brain and spinal cord, and the rest of your body. Chiropractic is the undisputed leader in the maintenance of spinal health that ensures that this communication channel remains free and open. Our chiropractic wellness plan, besides utilizing well-proven chiropractic techniques, also incorporates technology that effectively addresses postural issues as well as traumatic failures such as disc degeneration and/or herniation to enable your body to better handle lifestyle stresses and to enable a fuller, healthier, pain-free life well into old age. The next step in our Wellness Accelerator is performance achievement. This is our end goal for you. Why settle for mere existence when you can enjoy peak performance and quality of life? When you can choose to thrive? Remember, if you think you can or you think you can't, either way you are right. The choices that face you now are: 1. You can continue taking painkillers and other medications that relieve your symptoms, but allow your spinal degeneration to continue, whilst causing secondary damage to other systems in your body that could lead to surgery or other invasive options. Or 2, you can embark on this highly effective, well-proven, non-invasive and safe 10-day pain-free treatment plan. Pain is your body's call to action. Ignore it at your peril. So click on the button below and we will call you to set up an appointment for your consultation, for which you should already have a voucher.